All right. Good evening and welcome back to our special podcast, The Glass Cast, where we discuss important issues with evidence and facts, and also getting information from the professionals. So this evening we are going to discuss a very important health issues that concerns the men. But I will tell you, if you're a woman, come closer. And if you're a man, come even closer. Get your popcorn, have your cup of water, and let's engage in this important discussion. So today we'll be discussing important issue in men's health, as I mentioned earlier, and it's called prostate. It has been a big issue, most places, and sometimes people hear prostate and they get scared, maybe like it's a death sentence. But today we want to know if it's actually a death sentence or if it's something that is important in the health of every man. So to discuss this important topic with me tonight is by my immediate left, Dr. Udochukwu Wokorobia. Or in this session, you would hear us refer to him mostly as Dr. Kings. Also, by my extreme left, there is the double doc, Dr. Daniel Awomuku. So, without wasting much of our time, let's get the ball rolling. So, Doc, tell us about prostate.
Yeah, good evening once again, and thank you for your introduction. And prostate issue is a disease, or some people might call it sickness, that affects men. It doesn't affect women. It's purely men. And at a certain age in life, starting from the age of 40, Western world might tell you at the age of 50, but we from Africa, we started by age of 40. Once you are age of 40, it is necessity for you to go and check your prostate. How do you check your prostate? That's what maybe people might ask. Yeah, there's a test called PSA. But before I dive into that level, let me just explain the whole scenario. So prostate cancer was first identified in London through histological examination in 1853 by a surgeon at the London hospital in 1853. And he was the first person that discovered the issue of prostate. Now, what is prostate? Prostate is an organ in the human body. It's situated beneath the bladder, and it's dominated mostly in men. It's not in women, and it's a gland that passes through the bladder and the urethra. When you are about to ejaculate, it all passes from the prostate to the urethra to the bladder to the ejaculation. So prostate is an organ in our system. And when you reach at that age of 40, that is when you start noticing some people, it might be in their lineage. Some people who is not in their lineage might go to check if they have their PSA high or not. The shape of a normal prostate is commonly described as a walnut, and it measures about 3 times 3 times 5, and a volume of 25 cm, and it weighs 25 grams. The prostate gland is located at the pubic region, not public region, pubic region, and below the hypochondra. The organ could be divided into 4 parts, namely the anatomy side, namely anterior, the posterior, the central, and the anterior central peripheral side.
Yeah, very technical.
The growth and development of the prostate gland is regulated by an androgens such as testosterone. Every man has a testosterone. Testosterone is the hormones in men, and it's secreted by a hormone called Leydig cell. The prostate gland secretes alkaline fluids that contains zinc, citric acid, calcium, and phosphate. But look at the miracle here. The fluid, because of the way God created women and men, the women, their vagina is acidic. So, because it is acidic, the prostate, the work of a prostate is alkaline in nature, because the vaginal wall, the vaginal environment is acidic. That means if there's any sperm that goes into a woman's vagina, because of the nature of the acidic, it will kill that sperm. So God now made prostate seminal fluid to be alkaline, to neutralize the acidic nature of the woman after ejaculation, allowing the greater length of time for fertilization of the female ovum, which is the egg, to occur. In addition, the fluid contains what we call trace elements and protein that provides nourishment to the sperm. That means the fluid that comes through the prostate gland. At this stage, it's not a prostate cancer. I'll come over to that. But this is prostate gland as a whole. The fluid that comes through the prostate gland to help the ejaculation so that the sperm will not die in the vaginal wall of the woman is what will help that sperm to grow, to swim peacefully, to meet the egg. The fluid also contains some enzymes that ensure the liquefaction of the seminal fluid, and together with the zinc enhances the movement of the sperm. That means motorway, to make the sperm flow. Now, the prostate is beneath the bladder, but there's another issue there. To some people who are obese, to some people who ate some certain food, certain medication, certain lifestyle, the weight of the bladder might be pressing on the prostate, thereby making the man to be using toilet frequently. Okay? In my diagram, which I sketched myself, I drew the male region of male prostate of the prostate, the region of the man, and I would have pointed where prostate lies beneath, just beneath the bladder.
Yeah, you are free to show us here, you know.
Well,
you're
now,
free to point, you know, is it there?
God, who created man, knows why he created man. But if I divert a bit, I say when men slept, Satan came and put weed. What is this weed I'm talking about? The disorders of the prostate. The diseases of the prostate. The prostate disorders are classified basically into three conditions. We have what we call the prostatitis, which is the bacterial side of it. We have what we call the benign prostate hyperplasia. Benign is not cancerous, but the hyperplasia in it is that it has now enlarged.
Doc, if you will continue, if I may interrupt here, I know like some of our viewers, they would want to know where this prostate is located, because I know you made mention of it, because, you know, when you hear people discuss prostate most times, people usually want to identify it around the scrotum, which, from what you're analyzing here,
scrotum or scrotum sac,
whatever you call it, whether scrotum or
it's called the
scrotum.
scrotum sac.
Yeah, so I don't know. Is it close to the scrotum, or is far away from the
No,
scrotum?
it's not. It's is part of the men's ministry. Let me go out of medical terms.
Okay.
It's not under the scrotum. Scrotum is different from where the bladder is.
It's good to
Okay.
Yeah.
It lies just after the bladder. You now get the prostate, but because of the way it is connected, both the semen, both the urine will all pass through the bladder, your kidney, to your scrotum, urethra, and out.